Hi, good morning everyone. My name is Dr. Andrew Wong of Capital Integrative Health, and we are going to do in the next few weeks some bios of practitioners and featuring practitioner and just kind of telling their story about how they got into more holistic medicine, holistic healthcare. So I am the co-founder of Capital Integrative Health along with Elizabeth Baer, acupuncturist. My role at CIH is that I supervise the medical side, meaning the nutritionists and also the medical staff, such as doctors and nurse practitioners and PAs that work with integrative health and functional medicine as well. I also will coordinate a lot of care with some of our wellness providers, such as acupuncturists and therapists, and as well as massage therapists and myofascial release therapists. So I'm involved in a lot of the overall patient clinical care and kind of helping along with others to bring the team together and coordinate in terms of collaboration and education. I was 17 when I started volunteering at the hospital, and interestingly, I didn't know exactly what I wanted to do, except that I did want to do holistic health. So I have family members that have some thyroid issues, and they were able to reverse their thyroid issues with merely taking vitamin D and exercising, contrary to what the doctors had told them, which is that they have to be on thyroid medicine for the rest of their life. They were able to actually reverse that without medication, which was inspiring. Plus, I grew up in a background where, there was a lot of love of food, and, I was really, knowing that I wanted to focus on prevention. Another aspect was, when I was at the hospital, today I talked about during our training as a volunteer, things like, back exercises to prevent back pain and eating more vegetables like broccoli, etc., to increase your health or improve your health. And I thought that was pretty eye-opening to, sort of say that on the preventative end to volunteers, basically high schoolers or other volunteers that were interested in the medical field. And I felt that would be the best way to, proceed in terms of helping most people and helping people at an earlier stage before they get to a point where there's a lot of disease and a lot of things that might not be as reversible. So then I eventually went to medical school, and I chose Tufts because Tufts had a nutrition program in addition to medicine. So Tufts at that time was one of the few schools that offered nutrition courses along with medical school. Although Tufts is a great school, and I love Tufts, I love Boston, Tufts did not really give me the holistic nutrition that I was hoping for. It was more of a conventional type of program at that time. So I then proceeded eventually to get certifications in integrative holistic medicine, got board certified by integrative medicine, and I also did a fellowship with Dr. Andrew Weil at the University of Arizona in integrative medicine, and then eventually got a certification in functional medicine with the Institute for Functional Medicine. Along the way, I also did many other things, energy work, meditation, and Qigong with a mentor, learned about yoga, although I'm not very flexible. That was something that I really enjoy and still enjoy. And also did medical acupuncture with a Dr. Joseph Helms, who still teaches that course to physicians twice a year, so I was able to incorporate that to my primary care practice. So once I started to do primary care, after a year or so, I started to incorporate more lifestyle medicine, more knowledge of nutrition, and healthy movement and stress management techniques, including deep breathing, into my practice. I started to integrate the functional medicine into my practice with different advanced testing that would help patients. And basically, I didn't really know what to expect from all these things, but once I started getting results from patients, and they would be going to other places and not getting results, or trying things of their own and not getting results, it was really a game changer for a lot of patients, and it was really a game changer for myself as well in terms of my belief in how this works. So now it's 2019, there's a lot more research about integrative and functional medicine, and we know that the best way to prevent disease, the best way to reverse disease is to first focus on lifestyle as medicine, as food as medicine, meditation as medicine, movement as medicine. All these things can be our base for health and wellness. 80% of people will get better with those basics and those fundamentals that are core to healing. And then 20% may need functional medicine. They may need more precise testing in terms of identifying different nutrient deficiencies, different gut pathologies, particularly that would not be picked up by a conventional gastroenterologist. So that's how I got into integrative functional medicine. So glad to be here and glad to be hopefully of service to as many people as possible. So my focus this year is on really delving into the research in functional medicine and looking at all the nodes of the biological systems, such as the cardiometabolic system, structural system, immune system, the detox system, hormone system, for name a couple. So I'm doing a lot of research. We're having weekly team meetings that we're kind of discussing and learning about some of the emerging research that can happen so it can help our patients. So doing a lot of that. I also really enjoy consultation with other practitioners, either here or outside the clinic as well, in terms of if maybe the patient's not getting all the results that they're needing, just kind of taking a more aerial view or a kind of a bird's eye view of kind of what's going on and seeing the bigger picture and seeing if we can kind of move the needle for that patient. This year I'm specifically interested in two things. One is on how to improve our detoxification, because we know that unfortunately the environment and the earth are polluted, and increasingly we are exposed to about 80,000 chemicals a year. So how do we optimize our detox system so that we can preserve our energy and preserve our health? And so that's important, and we're going to be doing a lot more this year for that. Also, I'm really interested in brain health as well, because we know that without a brain it's really hard to function. And the brain is one of the biggest organs in the body in terms of consumption of energy. If we have a healthy brain, we're going to have a healthy gut, and vice versa. We're going to have a healthy body, and healthy mind, body, and spirit, essentially. And so, focusing on our physical aspects of wellness can often lead to the opportunity and ability to optimize the emotional and spiritual wellness as well. So those are the two areas I'm kind of working on this year, but really love what we're doing here, and hope to see you soon.